Hello everyone. First of all, thank you for the chance you have given me to present my work. My name is Natavan. I am PhD student from Turkey in Istanbul University Cerrahpaşa. I am working on the non-drug delivery systems. Today, I represent a part of my research, which is development of polymeric nanocarrier systems and in vitro studies. The content of my presentation will start with the nanocarriers. Why nanocarriers and then polymeric nanocarriers, their characteristics, types, advantages, disadvantages, optimal characteristics, then polymers, polymer types, polycaprolactone, the drug which I use in my research doxorubicin, methods of preparation of nanoparticles, evaluation of nanoparticles, and conclusion. Why nanocarriers? They ensure large surface area, provide large bioavailability, offer less toxicity. They can easily pass cell membranes. Their interaction with cell surface are possible. Targeted drug delivery to specific organ can be easily realizable. Provide good retention, consequently less clearing, enhanced bioavailability. Polymeric nanocarriers. They are polymeric nanocarriers that polymeric micelles, polymeric nanogels, polymeric nanocapsules, polymeric dendrimers, and polymeric nanoparticles. Polymeric nanoparticles and their characteristics. They are solid colloidal particles ranging in size from 10 to 1000 nanometers. Drug may be dissolved, entrapped, or encapsulated or attached to a nanoparticle matrix. They have very high surface areas. Drugs may also be absorbed on their surface. Polymer-based nanoparticles effectively carry drugs, protein, and DNA to target cells and organs. Their nanometer size promotes effective permeation through cell membranes and stability in bloodstream. Types of polymeric nanoparticles. There are two types of polymeric nanoparticles, that nanospheres and nanocapsules. Nanospheres are the matrix system which the drug is physically and uniformly dispersed. Nanocapsules are systems in which the drug is confined in a cavity surrounded by a unique polymer membrane. Advantages of nanoparticles. Nanoparticles can act as controlled release system depending on their polymeric composition. As a targeted drug carrier, nanoparticles reduce drug toxicity. Less amount of dose required. They enhance aqueous solubility of poorly soluble drug, therefore increase its bioavailability, therapeutic efficiency, and reduce side effects. Disadvantages of nanoparticles is high cost, productivity more difficult, reduced ability to adjust the dose, highly sophisticated technology, required skills to manufacture, difficult to maintain stability of dosage form. Optimal characteristics of nanoparticles are: it should be biochemical inert, toxic and non-toxic and non-immunogenic. It should be stable both physically and chemically in vivo and in vitro conditions. Restrict drug distribution to non-target cells or tissues or organs and should have uniform distribution. Controllable and predicate rate of drug release. Why polymers are used in drug delivery? Because they providing controlled release of therapeutic agents in constant dose over long periods. Cyclic dosage, tunable release of both hydrophilic and hydrophobic drugs. Agents affecting material selection for synthesizing nanoparticles. Size of nanoparticles required, inherent properties of the drug, for example, aqueous solubility, surface characteristics such as charge and permeability, degree of biodegradability and biocompatibility and toxicity, drug release profile desired, and antigenicity of the final product. Polycaprolactone is a soluble thermoplastic polymer obtained by chemical synthesis of crude oil. Although it is not produced from renewable raw materials, it is completely biodegradable. Due to its very low melting point, biocompatibility and high biodegradability, PCl is also of great importance in medical use. Doxorubicin is a DNA intercalating agent that causes DNA damage, resulting in cell death. In addition, this drug increases the production of reactive oxygen species in mitochondria. Polycaprolactone is a soluble thermoplastic polymer obtained by chemical synthesis of crude oil. Methods of preparation: emulsion diffusion method, salting out method, solvent evaporating method, and solvent displacement of nanoprecipitation method, ionic gelation method, production of nanoparticles using supercritical fluid technology, spray drying method. We use solvent evaporating method that consists of organic phase and aqueous phase. We used dichloromethan as a solvent, doxorubicin as a drug, and polycaprolactone as a polymer. And for the aqueous phase, distilled water, polyvinyl alcohol for the as a surfactant, and then mechanical stirring sonication process. Organic solvent evaporate by increasing the temperature and reduced pressure nanoparticles, and this used in vitro cancer therapy. Synthesis of doxorubicin PCl nanoparticles, that we use 1 milligram doxorubicin and 1 milliliter ultra pure water, and 3% 3 PCl for organic phase. And then we sonicate this in 2 minutes on the ice, and then this mixture is dripped onto 3 times more %1 polyvinyl alcohol on a magnetic stirrer, and then sonication process for 5 minutes at 100 Hz. Then mix it at high speed on magnetic stirrer for 4 hours, and 3 times centrifuge at 6000 RPM, and then for the drying put on lyophilizer. This is my method that I used in my study. That's polycaprolactone PVA. I prepare, and then my process going on. This is my study which I used in my study, and this is my photos from my study. Evaluation of polymeric nanoparticles, that nanoparticle size and size distribution, that's TEM, SAM, atomic force microscopy, laser diffractometer, and then surface charge, data potentiometer, and for the shape and surface morphology we use TEM, SAM, and atomic force microscopy. For drug nanoparticle recovery and drug incorporation efficiency, we use entrapment efficiency, drug loading, and for carrier drug interactions and physical state characterization, we use differential scanning calorimetry, X-ray diffraction, and FTIR. For in vitro drug release studies, we use dialysis bag diffusion technique, centrifugal ultrafiltration techniques. Conclusion: the aim of this study is to investigate the development, characterization, and efficiency of new nanoformulations on different human lung cancer cells in vitro by encapsulating it into PCl polymeric carrier systems in order to minimize the toxicity of doxorubicin, which is used in the treatment of lung cancer, and to increase its long-term efficiency and therapeutic index. In order for the drugs to be effective, the PDI value is planned to be less than 0.3 and their dimensions to be 100 to 300 nanometer. Results show that PCL is promising nanocarrier system with doxorubicin against to cancer cell in vitro. Thank you for your attention.